LCL, and then all the posterior lateral compartments. Osteochondral defect. You can see that this is where you're going to have a little part of the femoral condyle taken off or damaged during an injury, and this usually will be associated with a ligament injury. So this could be associated with an ACL, MCL type deal, meniscus involvement. We had one last year, and I mean, he had a complete knee dislocation pretty much, and he had an osteochondral defect. And if an osteochondral defect is present in the injury, it sets back recovery time by 2 months because it's considered a fracture, so they can't wait there or do anything on it for about 2 months. Meniscus tears. You have medial and lateral. So these are different kinds that you can have: double flap, posterior flap, bucket handle tear, and whatnot. Okay, so how do you get a meniscus tear? Like I said before, with the MCL, with a valgus force, you can get the meniscus tear that way, or you can get it with a varus force too, hitting someone from the inside and affecting the outer one. So it can be acute or it can be degenerative. So if an athlete at a younger age has an injury and they go in and they can't repair that meniscus, but they can shave it out, like I said before, you can have more wear and tear on those menisci, which will cause later problems in life. And then biggest advice about when you see a meniscus tear is they are going to have tenderness on the joint line, so on whichever affected side it could be, and they are going to swell up like a balloon. I don't think there is any meniscus injury out there that doesn't swell, right? They're going to swell and pain and tenderness on the joint line. So, okay, and they will report to you about like popping, locking, clicking, going upstairs, maybe like catching or something. You'll learn as you guys get on through. You can do these tests and you'll be able to actually recreate that popping and clicking sensation and be able to tell from there. Okay, so there's the tear and the meniscus right there. Let's see. Unhappy or terrible triad. This is where you get an ACL, MCL, and medial meniscus all torn. Touched a little bit on this last time. These are different bursitis you have in your knee. The most common is the prepatellar bursitis, and that's you can just get that from a direct blow as well with any of these, and they'll just balloon up and they'll present like that. And you can also get it from overuse as well. So, distal femur classified as supracondylar fractures, proximal tibia are tibial plateau fractures. They'll have immediate on pain, swelling, and what do you guys want to do when you think of fracture or anything? What do you want to make sure that's not affected? Yeah, neurovascular. So always check their pulse. You'll want to check like their popliteal pulse. You can check their posterior tib pulse as well. And always do what with fractures? Immobilize.
Immobilize.
on both sides fracture. These are tibial plateau fractures. And then back condylar. Then medial, and then condylar. What's wrong with this guy? Everything?
Just a second twist.
Put plumber urgent clear when you need it now.
Hurt that right knee. We're going to show the replay as he gets nice gesture there from the heat. But if you're a little squeamish, you might not want to look at it. And gets a rolling ovation. They were chanting Baron Davis. Baron Davis when he was down on the court before they put him up on the stretcher. Davis, you'll see on the replay again. If you're a little squeamish, you might not want to look at it. Sitting plant. Oh, yeah. See the indentation there. Davis knew right away.
Still dislocated.
Yeah.
So that's wrong. This one's kind of bad too. So this happened last year.
Wrapped up by
Oh, what?
and the ball came out, but it was rolled Lattimore down, and Lattimore's hurt. Marcus Lattimore holding his right knee. It was his right knee that he injured last year.
Figured out.
Tore his ACL.
Yeah, that doesn't look too
Missed the rest of the season, and then had a hip injury a couple of weeks ago.
We need him back.
That was terrible.
Tibiofemoral dislocation. Almost everything is affected in this, and I've actually seen, I mean, you can get it from a force, like an outside force, but I've actually seen the knee dislocation where it was completely non-contact, which, I mean, in the basketball one, you can see that his wasn't really even any contact. He just kind of landed and boom, it dislocated, so. Which I think is amazing, that the force on the body that you just create yourself and you can cause your knee to dislocate like that. It's pretty crazy, but so you can see sometimes it'll just go back into place or it won't, but ACL, PCL, MCL, and I mean, any of that can be damaged all at once. Meniscus as well. One thing you've got to make sure though is that you can feel that popliteal pulse in the back of your knee right here. That's very, very important that they keep that nerve intact in that artery.